afternoon. My name is Alexandra Lemley, and welcome to the latest event in our Compass Health Activation webinar series. Today's webinar is entitled, What You Don't Know About Open Enrollment Can Hurt You and Your Budget. Today's webinar is presented by Compass co-founder and Chief Medical Officer, Dr. Eric Berker. And with that, I will turn the floor over to Dr. Berker.
Great. Thank you so much, Alex. And thank all of you for joining today's webinar. We have a lot of our existing clients and prospective clients, insurance brokers, and benefits consultants that have joined the call. So really appreciate the opportunity to speak with all of you today for what you don't know about open enrollment can hurt you and your budget. So with it being August, we are approaching rapidly, I'm sure all of you are thinking about it, open enrollment season for the majority of groups. And before we get into some best practices around open enrollment, just want to share with you my brief background. As many of you know, I'm the co-founder, Chief Medical Officer of Compass. I'm a general internist. I did my training at Johns Hopkins in Baltimore, Maryland. And before I went into medicine, actually used to be a hospital finance consultant. Used to be back in the billing and business office of major medical centers, actually helping them get paid by insurance carriers and Medicare, because a lot of hospital systems actually have no idea how to get paid, so they hire outside consultants to come in and show them how to do that. So I had a wonderful claims experience on the provider side, but wanted to be more clinically oriented, so went on to medical school and residency. And really with myself and my co-founders, we wanted to take what we knew as doc and hospital insiders and bring that directly to companies and their employees as you move in the direction of consumerism and wanting your employees to be better stewards. I also write a blog that actually recently won honorable mention from Reagan's Healthcare, which is a very large PR firm. We had won honorable mention in 2013, and we won it again this year for 2015 as well. So super excited about that. And you can actually join the Healthcare Price Transparency group on LinkedIn to receive those daily blog messages as well, which we have over 2,000 members on that group on LinkedIn as well. So at Compass, we're tools and support for healthcare consumers. We have a Compass Health Activation platform where we provide employers and their employees with in-network price transparency delivered by a personal healthcare concierge. We also close gaps in care as it relates to preventive services like mammograms and colonoscopies. And also we direct folks to high-quality physicians and sort of patient-centered medical homes within their existing network, which is our Pathway solution as well. And so when you combine all three of those together, the results are really synergistic, and it's just awesome to see the results that employers are having with their health plans. Here are some examples of our clients. One of our more recent larger clients that we've added is T-Mobile up here in the upper left-hand corner. Super excited to be working with them. They're based in the suburbs of Seattle, but have employees nationwide that we support. High culture companies really across the board, from retail, Dillard's, to travel with Southwest Airlines, to utilities like Atmos Energy and Energy Future Holdings, education like Southern Methodist University, obviously manufacturing as well with Barry Wehmiller and Overhead Doors. So really, it doesn't matter what industry it is. We've really been successful in all industries. It's really been a matter of finding the right fit with the employer and the broker benefit consultant, which we've been able to do. And it's just been a great opportunity to work with all of you. And so with that, let's transition to talking about open enrollment. So a little personal background about myself. So I have personally presented at over 200 open enrollment meetings. So when we started Compass back in 2007, 2008, I actually personally did the open enrollment meetings. As a physician, it was really eye-opening to see how open enrollment occurred for people. And I kind of jokingly say this, but it's probably true. I'm probably the only physician in America that has done over 200 open enrollment meetings. And so just from that, in the trenches, boots on the ground experience, it was just awesome. And I just learned so much about how employers who do it right and others that have an opportunity to do it better, and how that literally translates into how their employees and their family members access the healthcare system, and how they receive quality care, and how they receive cost-effective care. And there absolutely is a direct relationship between how open enrollment goes and how employees act as healthcare consumers. And so we're going to talk about those open enrollment best practices today. And I phrase it in terms of these 6 M's of open enrollment. So we're going to go through these 6 M's. The first M is mandatory, and this is where as employers, you obviously have a choice of whether you want to do an active or a passive enrollment. So the active enrollment being that the employees have to actively choose what their benefits are, and if they don't choose anything, and they don't do anything, well then they're not on the plan. Versus a passive enrollment where people just sort of default into the previous plan that they were on in the prior year. And as you can imagine, for those employers that want their employees to consciously choose and do active enrollment every year, then one, they obviously are much more engaged in the whole open enrollment process, and it really provides a teachable moment, if you will, an opportunity to communicate and to educate with the employees, not only around which benefits to specifically choose, but then depending upon how the employer is set up, there is not a one-size-fits-all in terms of how this mandatory involvement in open enrollment should be. So depending upon the concentration of employees, you might have all employees at one large factory. You might have 1,000 people at one place, versus you might have a very large distributed sales organization where you only have, maybe 5 or 6 people in an office, or maybe even people working out of their homes nationwide, or a number of retail installations or stores. So you maybe have a handful, 3, 4, 5 people at various locations. And so that's where we've really seen leveraging video has been very effective, and then that video is oftentimes disseminated through an internet or an intranet, actually where it makes the employee watch this video as part of their active open enrollment process. Again, when it makes sense logistically to actually do it in person as well, and then really, almost lastly, followed up with the hard copy materials. So that's where I've seen some employers kind of lead with the hard copy materials, but if anything, it really should be leading with the video, leading with the content on the intranet site, leading with the in-person presentation, and then the hard copy materials are really there just to supplement it. Of course, not all of your employees will actually even be there during open enrollment, because you're going to have new hires over the course of the year. And so this is where we've seen for very high turnover organizations, whether it be in hospitality, retail, nursing homes, that some call centers, some of these employers have 50, 60, 70, 80% turnover in a year. So there's a very high likelihood that the employees that are going to be on your plan are not even there during open enrollment. And so there to inculcate benefits as a specific part of the new hire employee organization has also, quote unquote, been part of the, you can't just make it mandatory during open enrollment, you have to make it mandatory during new employee orientation. And then finally, really as a best practice, we've seen, and this really starts at the top, incorporating health and wellness and health stewardship as part of corporate values. And so this is where ArcBest, which is a soon-to-be Compass client, publicly traded company, it's a $2.6 billion firm based in Arkansas, they've actually incorporated wellness as a corporate value, and it's a newly added corporate value where they embrace total health. And so just to be able to point to that as a set of shared beliefs is obviously something that has been important to ArcBest, and really is a best practice that we've seen across our employers that make it a priority. If you do the opposite of that, in other words, you make it passive enrollment, you don't make the meetings or watching the videos mandatory, really what I've seen, you're only going to get half of the people's eyeballs. You're only going to get half the employees to ever watch anything. So just know that if you make it passive on a good open enrollment in terms of viewing materials, you might get half the people involved in the content, and the other half will essentially have no idea that it exists. Okay, number 2, make communicating with spouses a priority. So obviously your employees are great, but obviously their dependents, the spouses and the children, can account to up to 30 to 60% of the claims spend. And so this is where you've really only accomplished, quote unquote, half your battle when you've communicated with the employees. You also have to communicate with the spouse. And the types of claims that we oftentimes see generated by spouses are MSK, which is musculoskeletal, diabetes, cardiovascular disease, mental health, depression, anxiety, OBGYN, whether it's related to labor and delivery, but also things like benign ovarian cyst removals, things of that sort. And that is spread not only across the medical, but the RX spend as well. And so just know that if you are communicating with the employees only, but not communicating with the spouses, that's a major blind spot, especially as you're making changes to the plan. So if you're moving to a consumer-directed health plan, it's absolutely imperative that those spouses understand that plan design change. If you don't, they're just going to show up to the doc, and their deductible is going to be higher. Maybe their co-pays are gone. They may or may not even realize that they have an HSA or an HRA debit card. And so that we are seeing employers incorporate spouses as the required participants in a premium differential or in an incentive program. And so just know that in engaging spouses, not only do you need to make it a priority, but that you potentially need to add an incentive structure around involving spouses as well. Okay, so essentially the two goals during the plan year, you've got your plan-specific changes in terms of, are you moving to a CDHP, are you changing the deductible, how are the benefits changing? And then the other goal is there has to be some sort of mechanism for ongoing communication with the spouses throughout the year, right? So just because you're communicating plan changes or other messages during open enrollment, the spouse might not have a medical or a health issue at that time, and really you're doing open enrollment in October, they're a health issue that's actually in February or March, and the chances that they're going to remember what happened in October fairly low. So you really want to create some sort of mechanism to communicate with those spouses throughout the year. And we've really seen, obviously, with the ubiquitous nature of smartphones, that actually by communicating via video on a smartphone has been very helpful, whether it's through YouTube or Vimeo, and that, because obviously you can watch video on your smartphone very easily, and that way it allows you, with those very brief periods of downtime that might exist in your life. I mean, it literally might be, while you're out shopping or while you're at home getting ready to go to bed, and you have these very short, 1 to 3 minute periods, that if you can fill that with helpful benefit information via an easy format, i.e. video, to a spouse, incredibly impactful. And then also just, it's not as dynamic, but also just with emails to the spouses. We've actually found at Compass that for our concierge services, that the majority of the spouses actually really want to get emails from us, because they're the ones that are dealing with their problem medical bills at home, and sometimes they even get mad, not to make a generalization, they'll get mad with their male husband employee who didn't tell the female spouse at home about this particular benefit, and it's usually the female head of the household that deals with the health issues. And so this is where we've actually found that regardless of the industry, the majority of the spouses actually do have an email address as well, and the reason for that is because in order to have a Facebook account, you have to have an email address. And chances are your employees and their spouses probably have Facebook accounts. And so it's not 100%, but it likely will be a Gmail or a Hotmail account or what have you. But and obviously you don't make it required; they can opt out at any time. But to have that ongoing route of communication, we find is actually appreciated by the spouses. Okay, M number 3, message of stewardship. So I'm just going to read this here. How employees and dependents use their benefits impacts the health of the company, their future job prospects, and their fellow employees. So essentially, during open enrollment, it is communicated to the employees that if you can take care of the plan, then the plan can continue to take care of you. And we've seen a lot of employers that are self-funded actually do a good job of explaining to the employees that they are self-funded and what self-funded means. And even for employers that are fully insured, but over 100, 200 employees, I mean, your premiums, you're essentially fully credible. And so your premiums are solely a reflection on your claims experience. So even if you're fully insured, that message of stewardship of how people use the plan directly impacts the plan's financial viability. The story that I would use anecdotally, that actually when I did it, actually worked out great. I would do it in person. I would tell them the Aesop fable of the goose that laid the golden egg, where the farmer has a goose who lays one golden egg a day. He says it's wonderful. He takes wonderful care of the goose. The goose lays one golden egg a day. The farmer becomes fabulously wealthy as he continues to take great care of this goose. However, he begins to get greedy. He neglects the goose and even decides he wants to cut the goose open to get all of the golden eggs at once. And of course, when he ends up killing the goose, what happens? There's no golden eggs inside, and he has just completely destroyed the capacity for the golden eggs to be produced. And it's that same message in terms of taking care of the plant, where the employees are the farmers, and the plant is the goose, and the golden eggs are the benefits from the plant. And so obviously you want to take care of the plant in order to be able to continue to take the benefits. But here's the problem with that. Say, Dr. Bricker, that's wonderful. However, there was a very famous Gallup poll, it's done every year, in fact, I don't even think it's done quarterly, that says that only 32% of employees are engaged in general. So not only in regards to their benefits, but in regards to just showing up to their work and doing their work and being involved and enthusiastic and committed to their meetings and their tasks, or working on the assembly line or serving customers in a restaurant, whatever it may be. And 51% of employees are not engaged. That just means they're kind of checked out and they're sleepwalking through their job. And even worse, 17% of employees are actively disengaged. In other words, they are intentionally being disruptive and destructive within the organization. So obviously, those 17% of actively disengaged employees, they probably need to be managed out, but they're still, for whatever personal reasons, are still probably going to be on your plan. So just know that if you do a message of stewardship, that's probably only going to hit home with like 32% of your employees. And so for high culture companies, that 32% is average. I mean, there are high culture companies that I've worked with, but I would tell you that that number is probably at least double, if not even triple, where at least 60 to 90% of their employees are actually more engaged. And I'll tell you, that message of stewardship has absolutely resulted in higher employee healthcare engagement and better employee stewardship. And their plans have run like flat for the past 2 years. However, there are some companies that when we talk to them, they're like, our employees it's just not like that. Whether it's the dynamics of the business or its history or it's the market conditions, it's just a lower culture company. And so there, I'm not going to try to be Pollyanna about it, but essentially you have to use direct incentives and disincentives specifically for that employee, because they're not going to want to be stewards of the goose, okay? And so that's where we've seen employers use premium differential in terms of up to 30% of the premiums being different in the subsequent year, or their HSA or HRA contribution in excess of $500 is specifically contingent upon them, let's say, being involved in open enrollment, attending a meeting, attending a webinar, filling out a survey, what have you. So just take an honest assessment of what kind of culture your employees have and what percentage you think are actively engaged. High culture companies maybe can use a message of stewardship. Lower culture companies, you're going to have to use direct incentives and disincentives. Okay, medical is the main thing. M number 4 is medical is the main thing. So this is a famous quote from Stephen Covey, who unfortunately a few years ago passed away, very famous for writing The 7 Habits of Highly Effective People. And his quote is, the main thing is to keep the main thing the main thing. It's so easy for us in benefits and in our work in general to get distracted. And so it's very important to keep medical and pharmacy the main thing, because it's the majority of your spend and it's the health of your employees. So if you're, the national average, it's about $10,000 per employee per year, right? So you're talking for a company with 100 people on the plan, 100 employees or subscribers on the plan, you're talking $1 million. For 1,000 employees, you're talking $10 million. I mean, it is a financial significant. It's almost, I was in a very large benefits meeting on Tuesday of last week, and it occurred to me, it's almost like employee maintenance. It's like you've got maintenance on your machines or on your stores, and you have to invest in your employees to maintain them as being input into your business. Obviously, wonderful colleagues, but that is a very expensive proposition. People are expensive. And so you don't want to get distracted with dental or vision or short-term disability. In this same meeting, we literally spent the first half an hour talking about short-term disability. That only impacted literally 137 people across this company that had tens of thousands of employees. And it wasn't the main thing, and the meeting had gotten distracted. And so it's very important to keep that the main thing is kept the main thing to keep the main thing, okay? So the overall length of this open enrollment, whether it's a meeting or webinar or communication, the minutes should equal about 45. And this is where, again, with those over 200 in-person meetings, and shoot, I've done even more webinars on top of that, to keep it to 45 minutes. And here's what I've seen as a best practice. You keep it as a 1-hour slot. Open enrollment is super important, but it's almost never urgent, right? People are constantly fighting fires throughout the day in their jobs. Open enrollment for them is typically not one of those fires. However, it's super important, right? Actually being on the plan is super important, but they don't make it a priority. And so what happens is that they show up 5 minutes late. So, I mean, God bless them, they're trying their best. But actually, allow for that, don't start on time, start a few minutes late. And then also, you must allow time for questions. I mean, they've done research that shows that adults must learn by interacting. They can't just be lectured to, they must interact. So allow 10 minutes for questions, but obviously don't let it get out of hand. I mean, I'm sure you've seen it yourself, where all sorts of personal information, people go on and on and on. You don't want to let it get out of hand. You can take it offline, but certainly build in 10 minutes for questions as well. What does that mean? That means that you got the 80-20 rule left with those 45 minutes. So you want to spend 80% of the time on medical and a pharmacy and 20% of the time on everywhere else. So 80% of 45 minutes is 36 minutes. So you're going to spend 36 minutes on medical and RX, and you're going to spend 9 minutes on everything else. I mean, I've literally seen the worksite benefits and long-term disability and group life spent like almost the whole meeting on those things. It's like, that is, and oh, by the way, we're moving to a CDHP next year. That is obviously not the way that the prioritization should go. And it really sets the tone and facilitates learning. Okay, so then M number 6, our final M, is to mentor on consumerism. Again, this is a real teachable moment. And what we've seen, and this is, I've actually seen people's jaws drop open when I explain this to them during an open enrollment meeting and say, I never knew. And so this is literally the language I use. Even if you stay in-network, the price of healthcare services varies drastically depending on where you go. Even in-network, the price of an MRI, CT scan, endoscopy, knee scope, or blood test can vary by several $100s depending on where you go. That means at Hospital A, an MRI can cost $2,000, and at Hospital B, that same MRI can cost $600. And especially if you're on a high-deductible health plan or a consumer-directed health plan, then the employees have obviously a direct financial interest in this because of the way the plan is set up. And so to explain this to them is super important. Regardless of what tool you use your carrier's own tools, you use the TPA's tools, you use something like Compass, regardless, you have to show them about price variation. And then 2, another great message to mentor on consumerism is to use primary care. So the utilization of primary care is typically very low. And so another piece of language that I've used in meetings that's been very successful is, if you do not have a primary care physician, seeing one is a great way to receive your preventive screenings, right? It's covered at 100% too, it'll cost you nothing. And you don't, it's so hard to keep track of, okay, well, what do I need to get done, what do I not need to get done? Well, if you go to the PCP, they're going to follow the U.S. Preventive Services Task Force guidelines of what you need if you're a 45-year-old woman or a 52-year-old man, and that primary care doctor is going to help you get all those things done. And then also, once you establish care with a PCP, they can see you for many reasons, from minor illnesses to sprains and strains to chronic conditions like high blood pressure. A lot of people are just so used to this PPO mentality of just self-selecting to specialists that they've forgotten how helpful and useful a primary care doctor can be. And so obviously I'm biased because I'm a general internist, but I've really seen the benefit of driving people to primary care. So let's move to a case study now for a group that has really used these 6 M's of open enrollment as a best practice. So this is about a 4,000 employee company, high-tech manufacturing, so manufacturing but more technological manufacturing, employees distributed at fairly broadly across the country at their various factory installations and at their corporate office, and then they obviously have a sales staff as well. And so what they did was they used the Compass Get Connected member portal as one of their communication mechanisms for open enrollment. So in other words, the employees were required to do the Compass Get Connected process where they actually watched a brief video on how Compass can help them with their benefits. And it also takes a brief, what we call a consumerism risk assessment on what type of healthcare services they use, do they have any upcoming tests or procedures, if they have any chronic medical conditions, and that healthcare consumer risk assessment gets funneled directly to their health pro so that it almost is like an individual consultation or orientation with the health pro, so that the health pro can immediately start following up with them. And then the motivation for it was a premium differential. So in other words, in order to qualify for the lower premium, they had to go through this Get Connected process. And as a result, they got 90% of their employees to go through that process, which resulted in the first 5 months, 78% of their employees actually then came back and used Compass for things like comparative cost and quality information about doctors and hospitals and tests and procedures and lab, and also finding more cost-effective prescriptions. And then that translated into their, they had Compass before, but they didn't have this open enrollment best practice in place. And so when they put that in place, their PM for per subscriber, or per employee per month or per subscriber per month, went from 817 to 671. I mean, look at that. I mean, it's dramatic. And not only did it go down for the employer, the plan, but it went down for the employee as well. And I think that one of the keys is that when we had so many physician cost and quality information, is because we also, as part of that open enrollment requirement, actually got every single one of those employees that contacted us a PCP. And so the percentage of folks that actually had a PCP went from just under half to almost 80%. And so this is where we're not saying don't use your benefits, avoid care completely. The point is use care in a stepwise fashion, and start with a generalist like a PCP. If you need to go see a neurologist or an endocrinologist, that's fine. But making that first stop at the PCP not only gets you your preventive screening done, but then if you do need a specialist, that PCP is going to do a much better job of then routing you to the correct one. Self-referral gets people to the wrong specialist all the time. People think that they have, a particular issue, and they go and they see an orthopedist. They probably should have seen a rheumatologist. Maybe their musculoskeletal pain is really from fibromyalgia, and self-referring to an orthopedist isn't going to fix that. But if you saw a PCP first, then they would say, this kind of sounds like fibromyalgia. Let me get you referred to a rheumatologist. And that's really a much more, frankly, higher quality, more cost-effective way of accessing the healthcare system. And they saw their spend. I mean, their spend this year is dramatically lower, as you can see. And I really think it's a testament to using these best practices around open enrollment. So here are the 6 M's again. 1, mandatory. 2, make communicating with spouses a priority. 3, message of stewardship. 4, medical is the main thing. 5, minutes equals 45, and 6, mentor on consumerism. And we found, specifically for our clients that have Compass, that by following those open enrollment best practices, that it ends up translating into much greater use of the Health Pro. And this is Tara, one of our Health Pros. As I've told you before, it's not a stock photo. And this is where Tara and her colleagues that are assigned to each group. So one group gets Greg, one group gets Amanda, so you actually have a continuity of a relationship with a Health Pro. And they help their employees be better healthcare consumers or stewards by helping them understand their benefits, find great doctors, compare price and quality on medical services, find lower cost prescriptions, and then help with their problem medical bills. This is where these consumer pain points, or we act as the healthcare administrative medical home, integrating all of their benefits together. It's just really been awesome. And that message of integration really hit home at that at that employee benefits meeting that I talked about that I was at last Tuesday. They had all these great benefits, but they were totally siloed. And they're looking to Compass to be able to integrate all of those different benefits together. And so with that, we're going to conclude our Compass Health Activation webinar for today. Listen, as I say on these other webinars, you have given me the most important thing that you have, which is your time and attention, and I am so thankful for that. And if you would like to learn more about Compass, please feel free to email me personally. You can see my email address there, ericb@compassphs.com. And just to educate yourself on the blog, I mean, we had some brokers from out of town fly in to meet with us, and they read the blog every day. They came in from Alabama, and he said, look, I read it every day when I'm eating breakfast. So if you just want a very short piece of education that I think has been really helpful for people on a daily basis, then please access that. You can also watch previous webinars as well at our website, compassphs.com, best practices, and then you can see numerous webinars there as well. So with that, Thank you so much, and I hope you have a great rest of your day. Bye now.